more to this YouTube channel. Kindly subscribe to this channel. Don't forget to like and share this video. The topic is temporal fossa. Temporal fossa. We're going to consider the description of the temporal fossa, the boundaries of the temporal fossa, contents of the temporal fossa. We'll take a good look at the temporalis muscle. We'll look at the important bony structures that the temporalis muscle is attached to. We'll also consider the origin of the temporalis muscle, the insertion, the vascular supply, the nerve supply, and the functions of the temporalis muscle. Then the temporal fascia, that's the temporal fascia. Then we also need to consider the clinical importance of the temporal fossa. Right here is an illustration of the temporal fossa. You can see the temporal fossa bounded there by the superior and inferior temporal lines. That is the lateral view of the temporal fossa. Also here you have the lateral view of the temporal fossa. Then you can see all the muscles that are attached to the temporalis muscle is shown in the diagram by my left here. You can see all the attachments of the temporalis muscle shown there. Then the bony boundaries of the temporal fossa are also illustrated there. We'll talk about the boundaries of the temporal fossa shortly. Now, the temporal fossa or the temporal region is actually the lateral area of the scalp, and it contains deeper soft tissues that overlie the temple. It contains the temporal fossa actually has deeper soft tissues that overlie the side of the cranium. The temporal fossa lies superior to the zygomatic arc. So the zygomatic arch is actually at the inferior extent of the temporal fossa. So the temporal fossa is superior to the zygomatic arch. That is illustrated here in this diagram showing the lateral view of the skull. A temporal fossa, we need to consider the boundaries of the temporal fossa. I'm talking about the boundaries and relations of the temporal fossa. Anteriorly, you have the frontal and zygomatic bones, while posteriorly and superiorly are the temporal lines, that's the superior and inferior temporal lines. Laterally, you have the zygomatic arch as the boundary of the temporal fossa. The medial boundary as well as the inferior boundary of the temporal fossa is the infratemporal crest. Don't forget that the zygomatic arch and the superior and inferior temporal lines arise from the frontal bone. That is from the zygomatic process of the frontal bone, and as well as the zygomatic arch superiorly and posteriorly. And the superior temporal line fades away on the parietal bone posteriorly. Then the inferior temporal line continues and terminates at the supramastoid process or crest. We are looking at the boundaries and relations of the temporal fossa. The boundaries and relations of the temporal fossa. The boundaries and relations of the temporal fossa are illustrated right here in this diagram on the showing the lateral view of the skull. So the boundaries and relations of the temporal fossa are illustrated here. Taking a close look at the diagram, you can see that is actually formed by 4 bones: the frontal bone, the greater wing of the sphenoid, temporal bone, and parietal bone. They all form the boundaries of the temporal fossa. Yes, look closely at that diagram. You see that the 4 bones, that's the frontal bone, greater wing of the sphenoid, temporal bone, and parietal bone, are 4 bones that form the boundaries of the temporal fossa. These 4 bones come to meet at an X-shaped meeting point called the pterion. That is like a cranial meeting point for the 4 bones. The pterion is very important because it's a region below which lies the anterior branch of the medial meningeal artery. It lies deep to the pterion. You find this artery along with the corresponding vein, anterior branch of the medial meningeal artery along with the corresponding vein, and they lie below and deep to the lateral sulcus of below and deep to the pterion, and deep to that you find the lateral sulcus of the brain. So the 4 bones meet and form the floor of the temporal fossa. The frontal bone, greater wing of the sphenoid, temporal bone, and parietal bones meet and form the floor of the temporal fossa. And deep to this, the meeting point, that's the pterion, you have the anterior branch of medial meningeal artery together with the corresponding vein. And then when you go deeper, you find the lateral sulcus of the brain. Right here, you can see a clear illustration of the lateral view of the skull showing the boundaries of the temporal fossa, the 4 bones I talked about a while ago. They are well illustrated here. So don't forget that as far as the boundaries and relations of the temporal fossa are concerned, the frontal and zygomatic bones are located in the anterior border of the temporal fossa. Laterally, you have the zygomatic arch that is formed by the zygomatic process of the temporal bone and the zygomatic process of the zygomatic bone. All they come together to make to form the zygomatic arch. Medially, you have still talking about the boundaries of the temporal fossa. Medially, you have the infratemporal crest. Then, most, of course, above it, you have the temporal fossa. And below the zygomatic arch, there lies the infratemporal fossa. Clear illustration of the boundaries and relations of the temporal fossa shown here. You can appreciate the zygomatic arch. You can see the ramus of the mandible. The mandible has been removed so that you can see clearly the boundaries and relations of the temporal fossa. What are the contents of the temporal fossa? You have the temporalis muscle, the middle temporal artery, the deep temporal artery, zygomaticotemporal nerve and artery, and then the deep temporal nerve, which supplies the temporalis muscle. These are all contents of the temporal fossa. So don't forget, one very important content of the temporal fossa is the temporalis muscle, which is one of the muscles of mastication. Remember, you have other muscles of mastication like the masseter, the medial pterygoid, and lateral pterygoid muscles. And don't forget that all the muscles of mastication are supplied by the trigeminal nerve. You have via the anterior trunk of the mandibular nerve, which we call V3. So it gives branches that supply the muscles of mastication, including the temporalis muscle. Then the zygomaticotemporal nerve and artery are located anteriorly around the orbital cavity, and then these nerves, the nerve, zygomaticotemporal nerve and artery, pass through the zygomaticotemporal foramen. Now, what do you need to know about the temporalis muscle? Of course, I said it's one of the muscles of mastication. The temporalis muscle is a fan-shaped muscle on each side of the head. It has bony structures it's attached to, like the temporal bone, the squamous part of the temporal bone. It also has some attachment to the greater wing of the sphenoid, the frontal bone, and the parietal bone. Right here is an illustration of the temporalis muscle as seen on the lateral aspect of the skull. You can see the temporalis muscle there with a somewhat red color. And then the temporal fascia is also shown there with a kind of blue color. The temporalis muscle, you find it bounded by the superior temporal line and the inferior temporal line. Now, what is the origin of the temporalis muscle? The origin is, of course, from the temporal fossa and the inferior temporal line. The insertion of the temporalis muscle is such that it inserts at the margins and deep surface of the coronoid process, and also it inserts at the anterior border of the ramus of the mandible. Right here again is the temporalis muscle shown with the red color by my right. You can see the temporalis shown with the red color. You can also see the attachments illustrated there by the left. The temporalis muscle has some arteries that nourish it. The temporalis muscle is supplied by the deep temporal arteries, which come from the second part of the maxillary artery. And also you have the superficial temporal artery, a temporal branch of the external carotid artery, also supplying blood to the temporalis muscle. The nerve supply to the temporalis muscle comes from two deep temporal branches from the anterior division of the mandibular nerve. Remember, the mandibular nerve is one of the branches from the trigeminal nerve. Right here, you can see the temporalis muscle with the artery, the arterial supply well illustrated there. Then the nerves, the arteries and the corresponding veins that drain the temporalis muscle are illustrated there. Then the nerves that innervate the temporalis muscle I mentioned a while ago are all illustrated here. The arteries have a red color, and the nerves are also shown there. The nerves actually are shown there with a blue color. So the arteries and the nerves that take good care of the temporalis muscle are illustrated here. Now, a word about the functions of the temporalis muscle. The temporalis muscle, when it contracts, it elevates the mandible, and so it closes the mouth and the teeth. This movement is very important because the movement is brought about by upward pull of the anterior fibers and the posterior fibers of the temporalis muscle. The temporalis muscle is important as it helps in side-to-side grinding movement for you to grind food when you take in food and all that. I was just chewing some granite cake before a while ago, and then I had to do some grinding, so my temporalis muscle was at work for me to do that. Then the posterior fibers of the temporalis muscle retracts the mandible. That's after the mandible is protruded, for example, for it to get retracted, the posterior fibers of the temporalis muscle, they need to contract. The temporalis muscle is illustrated once again right here for us to see. Now, the temporal fascia, I need to talk about the temporal fascia. The temporal fascia, of course, is the deep fascia around the temporalis muscle, connective tissue around it. It is very tough, and you find that connective tissue in the temporal fossa. The temporal fascia is very tough, and it covers the temporalis muscle. The temporal fascia is attached superiorly to the superior temporal line. Inferiorly, the temporal fascia splits into two layers, and these layers are attached to the medial and lateral surfaces of the zygomatic arch. The temporal fascia also connects the zygomatic arch superiorly. The masseter is one powerful muscle. It's a powerful muscle attached to the inferior border of the zygomatic arch. When the masseter contracts, it exerts a strong downward pull on the zygomatic arch. So the temporal fascia tends to offer resistance to this strong downward pull. So it tries to neutralize it. So even when you are clenching your teeth, you find out that the masseter contracts and it tries to pull. It gives a strong downward pull on the zygomatic arch, but then the zygomatic arch is kept in place there thanks to the temporal fascia. Right here is an illustration of the temporal fascia. It has a blue color there. You can see surrounding the temporalis muscle, which is red color. So the temporal fascia is showing on the lateral view of the skull. Now, I need to talk about the clinical relevance of the temporal fossa. Why are we talking about the temporal fossa? You could have hypertrophy of the temporalis muscle, and this occurs in certain cases. It could be, it may be unilateral, that's on one side, or it might be bilateral on both sides. And when there's hypertrophy of the temporalis muscle, it makes the temporalis muscle prominent. So there is swelling of the temporalis muscle. You can observe the swelling just by in front of the ear. Then in the course of a treatment, for example, like someone that has a botulinum toxin infection that is affected by botulinum toxin, the antidote you give, the injection you give, can be administered cautiously in the case of hypertrophy of the temporalis muscle. So when you have hypertrophy of the temporalis muscle, what actually is the treatment? You could give botulinum toxin injection. So you have to be careful when you are administering this injection. You give it into the swollen temporal fossa, and it's usually done by a doctor. It's done to paralyze the motor nerve. So usually it depends on the severity of the hypertrophy and the patient's medical history. In some cases, surgery may be recommended aside from the injection of the botulinum toxin. Thank you so much for listening. I'll be very glad if you share this video if you like, and also if you subscribe if you haven't done so. Goodbye for now.